Okay, super interesting story. The White House Office of Management and Budget released a request for ideas for deregulation across the country. So, this applies to everyone, not just within the dental space, but all American citizens. Commenters should identify rules to be rescinded and provide detailed reasons for their rescission. OMB invited the public to send their proposals. We'll post the link. There's a full RFI to bring in your ideas. So, if you work in any industry and there happens to be a regulation or a policy that is above the business, it's coming from the federal government that you just do not like, small business owners, this is speaking your language. If there are things that really have got you all torn up, especially now that we're on April 16th, post tax day, as a small business participant, I can tell you it was a painful day. I think many small businesses also shared in that agony. Then this is your opportunity to at least express to the federal government your displeasure about certain regulations, so that maybe you've got a fighting chance for once to rescind and remove some of those regulations that are impacting your ability to do your job, run your business, and maybe, just maybe, make a profit. The second news story of the day, there is a coalition forming that's trying to help support uh, helping those individuals that are in public service. So, this is particularly of interest to the dental world because those dentists that choose to pursue a career in public service where they're working in public health clinics, heavily government supported and funded programming, often they are reimbursed or paid at a lower rate for those particular programs. They aren't usually of a normal earning rate for that particular job, but they do it because it's a part of their desire to want to give back to the communities in which they serve. And we're continuing to push for help within the loan forgiveness program because they often have these large student loan debts, very similar to those individuals that took out debts that are now working in the private sector, and yet their earning potential is different. So there's a coalition forming to continue to push forward with public service loan forgiveness. It is a national group that is working with the federal government to try to continue to protect that. But there also are state programs as well that provide loan forgiveness for individuals that pursue that. So just know they're working out there to try to continue to preserve that particular program. All right, the third story of the evening, which I think will get my sweet dear friend Jeff all excited, but honestly, just a little late to the party with this story. The Journal of American Dental Association has published an article this month highlighting that mandibular advancement appliances may be used effectively to reduce symptoms of obstructive sleep apnea. Now, just a little backstory, dentists have been working pretty actively in the sleep world for quite some time. In fact, really taking it on as a labor of love, I would say, to educate patients, identify patients who have sleep apnea risk factors, and talking to them about potential treatment options. Sometimes that includes an oral device in your practice, but many times it just is an opportunity to refer them back to their primary care physician to pursue sleep studies, potentially CPAPs and other types of therapy, surgery, et cetera. So it certainly there is an opportunity for treatment, but it quite often, at least in my practice, really just is an opportunity to have an oral health discussion, identify those risk factors, and then help the patient return back to their primary care physician for an in-depth conversation about their particular condition. Well, at least JADA, the Journal of American Dental Association, is highlighting the benefit of the oral device in the treatment modality of sleep apnea. This has been an area of ongoing research for over a decade, looking at these particular advancement devices and their role in sleep apnea treatment. We know that compliance is significantly higher with the mandibular advancement device than it is with the CPAP. So it had essentially kind of won over the population for that reason alone. But in actuality, the data also supports that it can effectively treat patients and that their symptoms are much better as compared to no treatment at all and on par with CPAP. Most patients are pursuing treatment initially because of snoring complaints by their partners. So that's probably the number one reason why they will show up in a dental office to even have that discussion. But many dentists now are pre screening for those patients, looking for signs of oral conditions that might suggest a sleep apneic condition or a sleep related breathing disorder so that they can have that discussion. And then many are providing oral devices at the request of the physician to be able to treat these patients. We can see now over a decade worth of research that this has a very important role to play in the treatment of sleep apnea. And we look forward to a continued collaborative effort with our physician counterparts and our patients to provide this as a treatment modality. I'm glad to see this article in JADA. Really glad to see it. We've been seeing articles similar to this in many other journal publications for over a decade now. Really happy to see it in JADA. And with that, that's the news.